am with Dr. Jonathan Olson, and today we are talking about health benefits of chiropractic care that go way beyond what you might think in terms of the typical chiropractic stuff like back pain, neck pain, and headaches. And obviously, we see tons of patients that have those types of ailments, but we also know through some really interesting new research and just through, clinical cases over the last 10 or 12 years that, when patients get adjusted and more importantly, they actually correct the structure of their spine, healing happens in the nervous system. We remove or reduce interference in the nervous system. And not only do people tend to have a lot less pain, but they have the potential to experience a lot of other health benefits as well.
Yeah, so one of the things he's referencing is a research article that we came across this week. It was out of the University of Pittsburgh Medical Center, so again, a pretty prestigious location for a teaching hospital. Anyway, in this study, they took about 3,000, almost 4,000 participants and put them against traditional medical care or this new variety that they're kind of experimenting with called a primary spine clinician. They measured hospitalizations, surgery outcomes, injections, and then prescriptions of opiates. And I don't have the numbers in front of me, but what I do know is that basically between 50 to 60% across all those measurements were decreased 6 months following the intervention given by basically chiropractic treatment. So 60% decrease, 50 to 60 in terms of hospitalizations, injections, basically opiate prescriptions, and then follow-up care with a specialist for surgery or other outcomes. So really, really cool to actually see it put head-to-head against traditional medical care. And yeah, turned out great.
Well, and a lot of these things weren't for just like back pain, neck pain, and headaches. I mean, some of the follow-up metrics that they looked at, if I'm not mistaken, were just like general or hospital admissions for anything, not just back pain or spine-related issues. Medication prescriptions for anything whatsoever, like any health condition whatsoever, surgeries for anything whatsoever. So they looked at, the prevalence and the long-term outcomes of people that did have musculoskeletal issues like back pain, neck pain, headaches, migraines, things of that nature. But they also, just for fun and out of curiosity, looked at other health outcomes, seemingly unrelated to people's musculoskeletal issue that they initially came in with. And that's what they found, is that overall there was a 50 to 60% improvement in someone's overall health and well-being, not just their back pain, neck pain, and headaches. And to us, it makes a lot of sense because, again, your nervous system runs and controls every function of your body: your heartbeat, your cholesterol, your blood pressure, your blood sugar, hormone balance, metabolism, sleep, energy, all of those different things. Every system in your body is ultimately controlled by your brain that sends signals down your spinal cord and out the nerves, kind of like an electrical circuit in a building, giving energy to all the appliances. And when there's interference in that system, which is exactly what happens when the spine is distorted or subluxated, as we say, or out of alignment, it's like a dimmer switch. It slows that energy down, or at the very least, it creates an interference. And that interference can result in inflammation, which can subsequently lead to things that ultimately bring people here, like back pain, neck pain, and headaches. But that interference also has the potential to, negatively affect the way that an organ or a system is working. And so when we correct the spine, which is not just chiropractic adjustments, it's, adjustments and physical therapy, for lack of a better term, and we're actually changing the structure of the spine, it reduces the interference in those neural pathways, and inflammation and pain can go down, which is, again, why people ultimately or initially come here. But it's not uncommon to also see other health benefits as well.
Absolutely, yeah.